what's up, everybody? This is Maggie Reichard, and you are listening to Nursing Uncharted, the podcast that delves into all different ways that we can use this license and having uncharted conversations in the process. Thank you so much for listening today. This is just a quick bonus episode. We're expanding on a conversation where I'm sitting down with Maria Grandinetti. She has been a nursing professor for 30 years. She has her BSN, her MSN, and a PhD in nursing education. And she has also dabbled a little bit in nursing informatics, which is this topic that I've wanted to talk about for a while. And so I was just really excited to know that Maria has a little bit of she teaches nursing informatics and she has a certification in nursing informatics. So I wanted to just do a little bit of a bonus episode that tailors to nursing informatics as we're talking about the future of nursing and kind of just like how we've been using technology in nursing and where we think it's going. So Maria, welcome to the show again.
Oh, thank you, Maggie. Thanks very much.
Yes.
I'm glad to be here.
Yeah, this is great. I was really excited to hear when you had a little bit of a background in nursing informatics because it is a topic that I've been trying to have for a while, and I thought it fit very nicely into kind of the future of nursing and, how we are evolving as a profession and in healthcare.
Now, I think that a lot of nurses may not have that knowledge because it's behind the scenes, the nurse informaticists. So they work behind the scenes. They really manage a good part of the electronic medical record and do a lot of teaching and really, they're part of the workflow of nurses in the acute and chronic care settings.
Absolutely. What are some things that what are some things that are part of the nursing informatics curriculum when you teach that course? What are some of like the hot button topics in nursing informatics right now?
Privacy, confidentiality, access to care, using technology. We learned about how technology is advancing in healthcare, and it should be and within our profession and at the bedside, but it also should not be a barrier between the relationship we have with our patients.
Yeah. Okay. So as far as privacy, what are some of the things that are being implemented now that affect us in the hospital setting?
Well, we teach our nursing students, and we know as a nurse that we need to keep private the information. And whenever we're documenting an electronic medical record, we want to make sure it's not visible to any visitors, or we want to keep it to ourselves and be aware of it. If we need to step away from it, we need to minimize it. We need to make sure protect their information, just like we've known about HIPAA for years. We need to protect their electronic information. Anything that is electronic, it's equally as valuable and personal as written information. So if we the sharing of it, the how it's shared, and permission to share it, and so on. We have patient portals, and that has been big over the past 10 years, where that's protected information, and the user needs to log in, and it is secured. So it's being protective, but also be sharing of information, which is really great with technology, that we can go get blood work, right? And then we can look on our patient portal and we could see our lab results like later in the day, which is a really wonderful thing. So those advancements are great.
Yeah. I think patient portals it's so now when I go to a doctor's office and they don't have a patient portal, it's almost like, where are you guys? Like you have to, because you become so connected to your doctor that you never were before. I can just message my, physician with a question that I forgot to ask, or if I needed some paperwork, the accessibility to your healthcare team is so much easier now, I think, with those.
It's about meaningful use. It's using technology in a meaningful way that could benefit not only the providers, but also the clientele, the patients. And
Sure.
yeah, when you see a paper chart, it's like, what is this? Where are we? What decade are we?
Yeah.
But
I gotta call somebody to get
it's
yeah,
like, to
no.
make an appointment? Wait a minute, But you could at
Yeah.
least, you could just do it on a portal. You can message your provider. It's been really great. And that's where kind of it flows into telehealth too, where you could also receive care
Yeah.
telephonically. So it's really wonderful that the advancements that really has telehealth has been around for many years, but it has really been highlighted since 2020, the pandemic,
Sure.
and it's still remaining, and it really benefits
Yeah.
people who work full time. You can't get to a provider's office, or those who are not able to leave the house easily, or they live in a more rural area, and so on. And so it allows them, and it's a little bit more private too, in a way.
Yeah.
And then
Yeah.
patients prefer that.
Yeah, absolutely. Do we see, when you're teaching nursing informatics, are they talking about how they expect technology to evolve in the future? Are there things on the horizon that we should be, expecting as far as technology goes?
It's like our profession is not stagnant, neither is the
Yeah.
technology. As the technology advances, so will all the technology that we use at the bedside. And we're so reliant on technology.
Yeah.
I mean, for our medications, for our documentation, for anything that could monitor patients. I mean, that's all technology, and it's great that it advances because it allows more early identification and more clear monitoring and documentation of the care that we provide to patients.
Yeah.
But we need to follow that. So change is always common in healthcare, and that includes technology. And we need to be open to that change. But oftentimes, once we understand the outcome of change, right, Maggie? I mean, we see it, we're told about it, or we learn about it, we're more likely to accept that change.
Sure.
Technology is always going to be advancing. So, which is, I think, I embrace change. I love change. I think it's great.
Yeah.
So, yeah, I mean,
Very
that
cool.
is our future in healthcare. More
Right.
technology.
Yeah. I remember in nursing school learning about, what are they called? It's like it's a printer, the 3D printers. I
Yes,
remember hearing about those and just being like in awe that somebody could like print an ear or something, or I think there
you can
was like
replicate
a,
it, right?
yeah, you could replicate like I remember going to a conference once and I think they were talking about 3D printing for pediatric patients that had tracheomalacia, which was, and I'm pulling this out of my rear end right now, but like it was patients that had pediatric patients who had like eroding tracheas, and they would create these, pieces of the bronchus, I think is what it was. And so just the fact that we can do that like is just an amazing, I mean, we live in such an amazing time, I think, for nursing informatics, just for technology and healthcare in general.
Right. And think about care of the diabetic patient, right? Over the years, I mean, pricking one's finger over and over again, now, right?
Yeah.
So now we use
Yes.
technology. We use our cell phones. We have devices that are attached to the skin that we can monitor and deliver insulin, monitor blood
Yeah.
glucose, deliver insulin. There's so many different things, so much advanced technology for preterm newborns as well, and monitoring,
Yeah.
their breathing, their growth and development. I mean, across the lifespan, there has been advancements that have really improved those, especially those who have either acute or those chronic, managing their chronic illness.
Sure. Sure. Yeah. Well, I think I could talk about nursing informatics forever.
Me
We were going to
too.
keep this a bonus episode.
Thanks, Maggie.
But I wanted to just, jump in and talk about it a little bit while I had somebody specializing in it. So thank you for coming on again and talking to me about nursing
You're
informatics.
welcome. I mean, it's a great profession. It's the nurses who have been a nurse for at least 5 years and they're interested in technology, and they like computers, and they're interested in improving the workflow of nurses and healthcare, think about that profession.
Yeah, absolutely. All right.
Okay.
Well, thanks so much, Maria.
Thanks again, Maggie.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Cary, assistant producers Katie Schrauben and Sam MacKay, and Aidan Dykes for the music and editing. Until next time, take care of yourself.